important because folks who live in a residential facility are here for a reason, and often that reason is because they physically can't take care of themselves anymore, which means they physically can't get out and about, can't seek out other ways to socialize like we can when we're living on our own. The people that reach out to them here at the care facility, their family, their friends, community members, it means so much to them because that is their social life, that is their social contacts. Of course, they have contacts with other residents and they have contacts with staff, but it's not the same as having somebody who is there especially for you and who knows you and wants to be with you. Their involvement with our residents is part of what I believe gives them a better quality of life. It's not just staying at a care facility to get your physical needs met, but your social, emotional, and spiritual needs also need to be addressed while they're here. Family, friends, and community members can do a really, really important thing by staying in contact and being in contact with these folks. Well, with COVID-19, we've had to have some really drastic measures to protect our residents. In the middle of March, we went on, I guess what you would call it is lockdown, where nobody but essential staff was allowed in the facility to protect our residents. During that time, community members and family members were able to have window visits outside the windows of the resident's room or outside the windows of the lobby at PLH. Or they were able to have FaceTime through their phones or through videos and iPads. Also just talking on the phone. Those were ways that they could be in contact. They also were in contact with letters, sending in cards and little gifts that brightened their day. Now that the COVID restrictions are being lifted somewhat, our residents are being allowed to visit, and these are scheduled visits with family out in the open air. They still have to remain 6 feet apart and wear masks, but they are actually able to see each other with no glass in between and talk with each other in that setting. Just reaching out to staff and finding out, is there a resident who doesn't have a lot of contact with family or maybe has no family at all, and what might be important to that person? It might be a bag of chocolate candy, it might be a card, it might be a DVD or a CD of music of some sort, it might be a flower in a vase. But staff can be able to tell you what their needs might be, and it doesn't have to come from people that they know. Just knowing that a stranger cares is important, and who knows, that relationship might develop into more than just being strangers. That's a really tough decision to make. It's a tough decision to make regardless of COVID, but when you have COVID happening and the restrictions at care facilities, you may not be able to see your loved one face to face for an unknown period of time. When someone's adjusting to a care facility, family likes to be there and be able to help them get settled in, and that may not be possible, again, depending on COVID restrictions. So what I would suggest to families is that you think about safety. Think about whether or not you are able to provide for their needs, either in their home or your home, either through you or through some sort of agency help to keep them safe during this time. If you're not able to do that, then looking at being placed in a care facility where those physical needs can be met may be the better option, but that is so individualized with each situation. Something I like caregivers to keep in mind, though, is that caregivers can really get burnt out. You can get burnt out because you have a lot of responsibilities, not only to the person you're caring for, but you may have a full-time job, you have other family members that you're caring for, you may have your own health concerns. You also have to weigh out, am I physically, emotionally, spiritually able to continue to provide high-quality care to my loved one, or might someone else be better equipped to do that? It brings about guilt for caregivers to think about not being able to provide that care, but we also have to take care of ourselves in order to care for other people. Even having someone placed in a care facility doesn't mean that you stop being a caregiver. You're a caregiver in other ways. But that, again, that's a question that I think people have to ask themselves individually and look at their own particular situation.